More than 70,000 patients, or over 90% of all confirmed cases on the mainland, have received TCM treatment, and this has been effective for over 90% of them. Of all the 42,600 medical workers who were dispatched from across the country to aid Hubei, the most affected region in China, 4,900 medics, or 13%, were TCM specialists. TCM is a useful tool for healthcare, but it has long been unfamiliar to people outside China. Some have questioned whether it is a science-based medicine, because it is indigenous to the country and in many ways, it looks so different from the more popular Western medicine. TCM is a healthcare system that originated in China at least 2,000 years ago and has constantly evolved based on millenniums of medical practice. Herbal medicine, acupuncture, moxibustion, cupping, gua sha, massage. Various forms of therapies are used to prevent or address health problems. TCM and Western medicine have different treatment modes. Western medicine tends to directly target the disease by killing the pathogen, a thing that causes illness, in the human body. It can encourage rapid healing and is effective for acute diseases. However, it often leads to the singular focus of treating the disease in a sick patient. Not much emphasis is placed on the cause of the disease, or the person's contribution to the disease. On the contrary, TCM believes in the body's ability to heal itself. It stimulates the body's own healing mechanisms and takes into account all aspects of a patient's life, rather than just several obvious signs or symptoms. TCM believes that a body in balance is a healthy body, and it takes multiple measures to help a patient to restore the broken balance. This type of treatment often takes a while to see results, and appears most effective for chronic illnesses. Western medicine treats the disease, while TCM treats the body. Since there is still no specific medicine or vaccine to treat COVID-19, Chinese health experts are exploring a treatment that combines TCM and Western medicine. In the TCM, 6 recipes have proved clinically effective in treating the infection, and some of them have been recommended in the latest diagnosis and treatment protocol for COVID-19, trial version 7. Number 1. Jinhua Qinggan Granule. It consists of 12 herbal components and can clear heat and detoxify lungs. It is effective in treating mild and moderate COVID-19 patients. Number 2. Lianhua Qingwen Capsule. Composed of 13 herbal components, it has shown curative effects on mild and common patients, especially in relieving fever, cough and fatigue. Number 3. Shui Beijing Injection. This injection was developed and marketed during the SARS epidemic in 2003. Consisting of 5 herbal extracts, it is effective in suppressing systemic inflammatory response syndrome induced by infection in the treatment of severe and critically ill patients, as well as repairing impaired organ function. The Chinese government has added treatment of the novel coronavirus to the specifications of the above 3 traditional medicines. 2 other TCM prescriptions: lung cleansing and detoxifying decoction, and Huashabeidu formula, have been approved by the National Medical Products Administration for clinical trials. Their main use is to detoxify and remove dampness and heat from the body. The last one is Xuanfei formula. With 13 herbal components, it is used for treating patients with mild and moderate symptoms. Research has shown the prescription can shorten the time it takes for clinical symptoms to vanish and for temperatures to return to normal. Apart from medicine, other TCM treatment methods, such as Tai Chi, acupuncture, foot baths and massage, are provided to improve patients' immunity. For more information and experience about how to use TCM to combat COVID-19, you can scan the QR code to visit covid19.chinadaily.com.cn, a website designed to share information about the disease and China's experience in overcoming it with the rest of the world. Many clinical studies and practices have shown the effectiveness of TCM in treating COVID-19 patients. Here is an outstanding example. Jiangxiao Makeshift Hospital in Wuhan, capital of Hubei, was the only makeshift hospital to treat patients primarily using TCM methods. During its 26-day operation that began February 14, it admitted 564 patients, and no patients with milder symptoms saw their condition worsen into a serious one and no one tested positive again after recovery. Although the clinical results are quite good, many people still have doubts about TCM remedies because of the lack of laboratory evidence. In response to this question, Du Bin, medical ICU director of the Peking Union Medical College Hospital and an expert dispatched to fight on the front line in Wuhan, gives his explanation. They have rather different philosophies and different evaluation systems for efficacy. TCM doctors will give different medications to patients with similar symptoms in the opinion of a Western medicine practitioner with different doses every day. It will make the evaluation system for Western medicine invalid, so it is hard for a practitioner of Western medicine to assess the efficacy and safety of TCM from the point of view of Western medicine. Western medicine's way of evaluating a specific drug's efficacy is to separate patients into random groups and compare clinical outcomes after administering drugs of fixed doses. But he also encouraged his colleagues in the TCM sector to adopt the evaluation or assessment system of Western medicine to better introduce what they are doing to the rest of the world. TCM and Western medicine are like steamed buns and bread. One is not superior to the other. What matters is they are both capable of treating disease, said Lu Chengtuan, head of Beijing Hospital of Traditional Chinese Medicine. As the COVID-19 pandemic is spreading rapidly around the world and becoming a global enemy, China has shared its TCM approaches to combat disease with the rest of the world. China has donated TCM products, ranging from Chinese patented medicines to acupuncture utensils, to dozens of countries and regions including France and Italy. A total of 50,000 health kits consisting of Li and Hua Qingwen capsule and face masks have been delivered to overseas Chinese students in 20 countries including the United States, the United Kingdom and Italy. Lianhua Qingwen capsule has won approval to enter the Thai market, and French researchers plan to conduct clinical research into using it to treat patients. It has also obtained marketing authorization in Brazil, Indonesia, Canada, Mozambique, and Romania.